Toilet training can be a wonderfully exciting and equally frustrating time in a family's life. It will require time, patience, a sensitive approach, age appropriate communication, a developmental understanding of the child, and maybe even a little faith in the process. It is important to start the conversation about toilet training with families early on. Healthcare providers can introduce the topic of potty training at the 9-month, 12-month, 15-month, and 18-month well child visits. During these discussions, talk about potential strategies to use, parents' possible expectations, and how to safeguard for positive toilet training outcomes. The American Academy of Pediatrics advocates for toilet training to begin when both the parents are ready and the child is of a developmentally appropriate age. This may mean starting as early as 18 to 24 months or as late as 3 years of age. Before beginning training, recommend to parents tips or suggestions on how to familiarize the process to the child. Parents may start by reading toilet training books in preparation of practice, bringing a potty chair into the home, introducing the subject of pottying in age-appropriate conversation, such as, "I wonder if Elmo needs to go potty," teaching them proper hygiene in the bathroom, and by becoming aware of the signs of readiness to toilet train. Teach parents that toilet training typically occurs first with mastery of nighttime bowel control, then daytime bowel control, then daytime bladder control, and lastly, nighttime bladder control. Toilet training is a child-led process. A child needs to first have the physiologic capabilities in place prior to starting toilet training. This includes having voluntary sphincter control, sensing the urge to void, and having the ability to stay dry for greater than a 2-hour period, along with possessing the gross motor competencies to be able to assist their parents with dressing and undressing themselves. Additionally, children should have certain cognitive skills in place as well. These skills include understanding the need of urinating and stooling, the function of the toilet, the ability to follow simple directions, and being able to communicate their basic needs. Behavioral cues of curiosity surrounding the purpose of the toilet and a conveyance to parents of wanting to be dry all signal readiness to toilet train. Tips for a positive toilet training experience include keeping your child as dry as possible with frequent diaper changes, choosing a good time to start, such as in the summer months when your toddler can be in as little clothing as possible, introducing a routine such as first sitting on the potty with clothes on, then clothes off, setting up a schedule of regular times of sitting on the toilet, such as when their child first wakes up, before going to bed, and after meals. Other recommendations include demonstrating the process and allowing for practice time, teaching them how to use the toilet and the function of flushing, making it personal by letting them pick out their own training pants, handling setbacks gracefully, and always rewarding success by giving constant positive feedback. Never punish or reprimand for accidents. This could potentially lead to withholding behaviors and bowel or bladder dysfunction. Toilet training issues is also one of the most prevalent risk factors that can precipitate child abuse. If training is not progressing, communicate to parents that it's okay to walk away, step back, and take a few days to recover, and then return to the toilet training practice. Regression issues in toilet training could stem from a number of reasons. Major changes in the toddler's life, such as the addition of a new sibling, a new move, a change in childcare routine, or family stress can exacerbate a child's progression. Healthy Children supports understanding your child's emotional development and that toddlers are still learning how to express their emotions into words. Help them to identify the problem, sympathize with them, and clarify your age-appropriate expectations, and work together to find a solution. For parents and families that wish to learn more about toilet training, many resources are available. Additional resources can be found on the American Academy of Pediatrics website, healthychildren.org, the Bright Futures website, and kidshealth.org.